No, my picture was up on the phone right now on Facebook. Are we hearing music?
You're live.
Are we live? Can you hear me? You can hear me.
No, my picture was up on the phone right now on Facebook. Are we hearing music? We're live.
Where's our intro?
We're already here.
We're done with our intro? Oh my god, this is great. I wasn't ready for that, were you? That was the fastest intro ever. Okay, so you guys, I'm going to shut off my phone here. That's so funny. I thought our intro usually goes a few minutes. Apparently not tonight. How are you, Kelly?
We have a lot to talk about.
We do. There's no time for messing around. This is crazy. We definitely need to hear what you guys have to say. Hi, everybody. I'm looking down here. I see some of you guys are on with us now. Adriana, Sarah Coronado, just to name a few of them. You guys are getting in there. Cecilia says hello. It is so good to be here tonight. We have so much to talk about. And oh my goodness, we have a new background. I don't know if you guys noticed our new setup. You guys notice that?
We're getting fancy.
It's getting fancier, people. We are excited you guys are here. We're going to give you guys a few more minutes to populate with us. We usually don't go this live this fast, but you know what? I'm going to talk about my week with you. We've had a couple crazy weeks.
Yeah, we have. We've been busy. We've been busy. And
super busy.
And cool, because we decided our topics a while ago, but I have noticed that a lot of questions are being asked about these topics. And so
always.
I think it's timely. I think these are good things to chat about.
I love that. You know, someone was asking me the other day about some things that happen during pregnancy and why they happen. And it made me think of when you and I taught at the Sexology Institute. We taught a class and we were breaking it down by trimesters. First trimester, this type of sex is cool. Second trimester, don't be doing this as much, go to this. Third trimester, you're fair game, but you got to see how it goes, right?
Right.
But we're going to talk about the aches and pains of pregnancy and some of the things you might expect during the first trimester, second trimester, third trimester, and even all the way through. For some people, they get a lot of these different things happening, which can be a little bit concerning.
Yeah, I mean, we'll cover the gamut of kind of the normal things, winter warning signs, and that situation can also change depending on kind of what's going on in your pregnancy, because there's some things that should be concerning for some patients and probably not as concerning for other pregnant women, depending on what's going on with them.
Absolutely. So I guess we can just start it out by saying someone looked at their pregnancy stick and they're like, we're pregnant.
We're pregnant, and that explains why my breasts are so tender. I was wondering, which is why I peed on the stick in the first place.
Yeah,
so
they were late for their period.
Exactly. So breast tenderness, I mean, that is one of the first aches and pains that you're going to have.
Nipple soreness.
And it's not a bad thing. It's not a pathologic thing. It's just reflecting what your hormones are doing. It does not indicate how awesome of a breastfeeder you're going to be. It really doesn't tell you much about the pregnancy.
It's a healthy pregnancy.
At all. It actually doesn't even tell you that. I mean, it tells you that you're pregnant. But it can be the first sign that you're pregnant, and it's a normal sensation, and it will get better. The breasts are not going to be so incredibly exquisitely tender and sensitive for the entire pregnancy. It's really going to probably get better, about 8, 9, 10 weeks along.
Yeah, the first trimester is a little crazy because most people will develop some sort of morning sickness as well, so they'll have nausea, and for some of them it'll be the entire day sickness. So not just morning sickness.
Right.
We're talking all day. But there are a couple things that you can do during this kind of a situation. What are some things that you tell your patients?
So first of all, you are no longer eating 3 meals per day. I like to break it down into what I call hobbit meals. If you've seen Lord of the Rings, you know they do first breakfast, first lunch, second lunch.
So does my daughter.
So does your daughter, and so should a pregnant woman, because there's not as much room in there, and the stomach is very slow to empty. So you're going to have more reflux, you're going to have more heartburn, and if you're trying to pack in an entire breakfast into that stomach that's already full, you're going to have that discomfort. It's going to kind of make you have some cramps, it's going to make your belly feel a lot more bloated, and it's going to increase that nausea that you're having throughout the day. So you're eating more like 6 meals, small meals throughout the day, maybe a couple snacks along the way. Number 2, and this is super important, is not eating and drinking at the same time. So if you're used to having like a glass of milk or a glass of water, a glass of wine with your meal, wine is out, but you're not really supposed to have that glass of milk with your meal. Maybe a couple sips of that water or milk have your meal, and then about 30 minutes later, then go ahead and drink your fluids, get your liquids in that way, because the fluids are going to really expand that
Blow you up a
stomach
little
and
bit.
blow you up a bit and increase that bloated feeling, that discomfort, and that reflux.
And you don't want to have that on top of the nausea. That's
Right.
really
I mean,
miserable.
it can definitely make it a lot worse.
Absolutely. Okay, so I have a couple things I like to tell my clients too. And look, I'm not giving you medical advice, but I'm using some common sense here, and for a lot of people it tends to work. So my thought process on the whole morning sickness thing is that not only are you having all these changes to your body with hormones, your blood is almost doubling in capacity. When I think of that, I think of glucagon, I think of insulin, I think of how all these things relatively work. And when you have all this extra fluid coming into that system,
Right.
and you're starting to build that up to support the baby, you know, I think that your body kind of goes, what the hell's going on here? So when people eat, they tend to think about eating a certain way, which is, I can eat whatever I want because I'm eating for two. I'm going to
Right.
have Twinkies. I'm going to have Pop-Tarts. I'm going to have this. I'm going to drink a Dr. Pepper right first thing when I get up, or blah, blah, blah. And this can be a problem. I tell my clients, if you're really thinking that you're having some serious morning sickness and it's going to get worse, you can tell it's progressing, change your diet, first of all. So I like them to try like a diabetic diet. And like I said, I'm not trying to give medical advice or anything. I'm just giving common sense advice, like someone you'd hear that had gone through it. I'm like, just eat like a diabetic diet. Eat more protein. Things, you know, eat smaller bunches, like Dr. Morales was just saying. Eating smaller meals, taking your time with them works. But what I find is what happens the first thing in the morning. The alarm goes off. People get up. They're like, ugh, I feel horrible. They're walking around kind of feeling gross. Stay laying in bed. Have a hard candy next to the bed. Take a hard candy for like a minute and a half. Let that sugar go in or whatever's going on. Then you put it down. Take a cracker next. Eat a cracker. Then
Don't
whistle.
get out of bed yet.
Then
Stay in
whistle. Yeah, stay in bed. Whistle
And
when you
then
have
whistle?
the cracker. And yeah, no, just kidding, don't do that. But it's fun to do. Have you ever eaten a cracker and whistled? It's fun. Okay, so.
Can we have a cracker? I need an example.
Yeah, I would
Let's
do it
talk
too if we
about
have one. Okay, so check it out. So, you know, eat a cracker, then stay in bed. Like Dr. Morales was saying, don't get up yet. Wait for another like minute, then get up. And when you're feeling great, don't go about your morning to go do things. Go make food. Make some eggs. Make something that's low carby, and
That's
eat
protein.
that. Get the protein in, and then go about the rest of your morning. But that usually tends to help people.
Yeah, definitely. I mean, a big part of that early pregnancy, it's your muscles and your ligaments and your tendons and the things that we're going to get to in a moment that can ache and pain. It's not so much that at that point. It's just this discomfort, this bloating, this like blah sensation.
Yes.
So I think I agree. Doing those things can definitely decrease that just kind of ickiness
Yes.
that you feel in the first trimester.
And then people feel like they have
So-
the flu sometimes
Yeah.
during the first
You
trimester.
feel just extra tired. You're going to feel very kind of short of breath, which
Yeah.
a lot of that has to do with all that extra progesterone. Progesterone is the hormone that's keeping you pregnant. So you're going to have a lot of extra progesterone running around, and progesterone can make you tired. And it can make you just feel winded, like you can't quite get enough air in, even though you're obviously getting enough air in because you're walking and talking and you're doing fine.
Absolutely.
But that's normal. That's where that sensation comes from.
Yes. So
So-
people feel like they have the flu. That's another normal thing that you can expect.
Mm-hmm.
What you shouldn't expect is to be completely dehydrated and start really having an issue getting
Right.
out of bed, this and that. That should be cause for alarm. That's when you should call your doctor and say, hey, listen, I've been throwing up. I don't feel good. Something's wrong with me. I don't want to get out of bed, this and that. That's when you have to take action on it, because you may need some IV fluids. Maybe there's something else going on. Maybe you have another infection or something that you don't even know that you have. You're confusing it with being pregnant. So you don't want to let those lines slip and blur, because that can be a little bit dangerous.
Absolutely. I mean, the term hyperemesis is thrown around a lot, and just having the nausea, vomiting in pregnancy, even if it's pretty severe, is not necessarily hyperemesis. But hyperemesis gravidarum it's a bad deal. That's a hospital admission. That is significant medications going through an IV, sometimes steroids to calm things down. People can get really sick with it. But if you're pretty sick, you're in bed, like you said, you just don't feel like getting out of bed, you can't do your normal day-to-day activities, that's an unacceptable amount of nausea, vomiting in pregnancy. So
Pick up
call
the
your doctor,
phone.
let them know there are some things that they can try and do. And certain medications that you can probably get a prescription for that might be able to reduce the severity of that. But here's the good news with all the nausea and vomiting.
I love it.
Traditionally, it'll start at about 6 or 7 weeks. It peaks at about week 12. So that's a month and a half or so. Peaks at week 12 and then slowly gets better and should be significantly better by about 15 or 16 weeks. So that's the second trimester. That's when you get to glow. The second trimester, as I tell my patients all the time, I'm like, yay, you're in the second trimester, you're glowing. Isn't she beautiful? She's glowing. So that's when you're going to feel good. And that's when your nausea and vomiting should get a lot better.
I like that.
I think
something else that I want to bring up is don't get too excited that that's happening. You're going to be glowing and everything, but do expect that there's a possibility you're going to start running into something that people say is funny, but it's really black and runny. Diarrhea. So I told you I was going to do that tonight at some point. All right, I slipped it in there. No pun intended. So okay, so yes, so diarrhea can start happening as well as constipation. These are normal things that happen throughout the second and third trimester.
Constipation can be evil, but you know what? I don't get a lot of patients that ask me about it. I usually have to ask them, and I say, hey,
they're
how's
shamed.
your constipation? And they're like, oh my God, it's awful.
How did you know?
How did you know? It's awful. So you're taking prenatal vitamins, which have iron constipate. You might even be on extra iron. Let's say you're anemic in pregnancy and your doctor puts you on extra iron. That's even more constipation.
Yes.
Let's say that you've got, already some bowel problems that predated pregnancy. Well, pregnancy doesn't always make them better. It can make them worse. That and then pregnancy itself slows down your gut. Your body's trying to absorb as much of the nutrients and minerals and water as possible. So it's going to slow everything down, and the slowed down gut translates to constipation. So you got to get your fiber in there. You've got to increase your water intake. You've got to be drinking water. Cutting back on your caffeine, cutting it off if possible, but definitely cutting back on your caffeine so that you can retain some of that water so that you can actually have some normal bowel movements.
Yep, that makes a difference. What about prune juice?
Prune juice is really awful tasting, but it's very helpful.
It's tried and true.
Yes, and I have a trick about that. So if you're taking prune juice, it's got to either be really cold or a little warm. So if you put it in a mug and you put it in the microwave and you heat it up for a little bit until it's nice and warm, you can even put a little half teaspoon of Miralax or something like that in there, stir it up. This is what they use in all of the nursing homes. This is a nursing home trick, and it works amazingly. So getting your fiber, getting some prune juice maybe, and if you have to be on a stool softener, I always recommend to use something like Colace or Ducasate. I like to stay away from Cinna products because those do tend to make you a bit more crampy. So if you are constipated and you're having some cramps, that's not a good combination. So probably just the Ducasate.
Could you imagine? And then, because soon in your third trimester, your body's going to start checking out what it's like to get a baby delivered, so you're going to feel like period cramps.
Exactly.
And you're going to be like, what the hell? Why am I having period cramps? When I'm not having my period, I'm going to have a baby pretty soon.
Right.
It's because your body's starting to check it out and starting to move around and get that baby a little bit lower. It's the body basically saying, hey, your eviction notice is coming, so you got to get cool with that. And the baby has to figure it out. So what happens next is, not only are you starting to get these kinds of cramps, you have relaxing going through your body, really heavy, which is a hormone.
Is that a spa treatment? Is that something you can
It should be.
And you get
I want
relaxed? It relaxes you.
Relaxing goes to all your cartilage in your body and makes it really pliable, so that if you think about your pelvis and how that's shaped, you've got in the front, you've got the pubic symphysis, and the pubic symphysis is all cartilage.
Two bones with the cartilage in between.
Yeah, we used to make fun of when we were kids. We go, oh, it looks like pee, because it was yellow, the cartilage was put in there. It's so stupid because it was on the pelvis. 4th grade. Okay, so so you see that, and then on the back you got the sacroiliac joint. So you have the sacrum coming down like that. It's 5 fused vertebra, and you have the tailbone there, the coccyx on the bottom, and this right here connects to the pelvis. So you have the sacroiliac joints, the iliac crest and iliac region of the pelvis connects right there, and that has a lot of cartilage too. So that starts getting a little funky. That's when mom's getting ready to push. Her pelvis can expand and let that baby out.
And your bowl of muscle, your levator muscles. A patient told me earlier this week, and I had no idea about this, but pelvis actually means sink. So that makes perfect sense. You've got this sink of muscle, and muscle attaches to bone with ligaments and tendons, and all of those things are getting relaxed in pregnancy. So of course there's like this kind of ache that happens. There's some pulling, some tugging sensations, and it doesn't take much of a turn or a twist or a lift or pulling on one of those muscles for that to actually cause some kind of weird little twinges and some things.
Yes.
So yeah.
Absolutely. We have a couple of questions, I think, and we'll get back to talking about that. And then we're going to take a break in a few minutes, real quick, guys. But we're going to be right back. So we have Seattle in the house. We have people saying hello. All these great people. Consuelo's here. Cecilia's here. We have Sarah. Sandy says, yes, Seattle. Kennedy says hello.
Sweet.
Alexa says hi. Nice background. Thank
Hi,
you, guys.
Amber.
You're noticing, Amber, we're getting fancy here. I think it's a fancy night. I'm feeling fancy. Are you? Lizzie says hi. She says thanks for the info. We're glad to do that. Sky says we're dressed up. Valerie says we're already having acid reflux. This is great. Other than Zantac, this is great. Is there something we should eat?
So some people would say to stay away from the acidic foods, your tomatoes and things like that. I don't know really that helps a whole lot, but different people's stomachs respond differently. So if decreasing the acid in your diet helps, decreasing citrus foods and things like tomatoes and that sort of thing helps.
Go with watermelon or something that's like a cold,
right,
a non-heat food.
Right, or something kind of mild. Maybe you should be sipping on some milk instead of just regular water with your meal, and see if you can kind of drop down that temperature a bit and drop down that acidity.
Yes, absolutely.
But
look for non-heat foods.
Yeah.
It's like in the Chinese medicine ritual. That's pretty important.
That sounds pretty good.
Non-fire.
And you can take things like Tums and Maalox in pregnancy. The thing of it is, if you look at the backside of the bottle of Tums, it's going to say, do not take more than 5 times a day, or whatever it says.
It can hurt your heart.
Well, the reality is that I think the company's pretty smart, and they know that if you're having to take that 5 times a day, you probably need something else.
Yeah,
that's
something
not
wrong.
working. So you probably will need something like ranitidine or Zantac, which is safe in pregnancy, very common to be taken in pregnancy once or twice a day. So if you feel like that Tums isn't working, talk to your doctor. Find out if they have a recommendation on what you should take to decrease that acidity.
Yeah. People like white rice too during that, like bland things. Like think of the banana.
Yeah,
banana
the brat
bread,
diet. The bananas,
applesauce.
rice, right, and toast, applesauce and toast.
Toast, turkey.
Look, there's a rockin' dad here.
Hey, there we go. I like
There's
that.
Leslie White checking in.
Good, I love that. Leslie's always with us. Hey, Jeremy, good to see you tonight. She said, I'll use Tums for heartburn. It works in milk before bed. Well, that's fantastic. Thanks for the hearts, you guys, by the way. I see those coming up. We're just reading these that you guys are saying. Erica Cesar Hernandez, someone who attended one of our classes. She's a chiropractor here in town. She says in her experience, chiropractic care can also help moms with bowel movements and all the other aches and pains that come along.
Yes.
Pubic, pelvis, back pain, and sciatic as well. Thanks, Erica, for that.
Especially if you go to a chiropractor that kind of specializes in the female health and the female musculoskeletal system. Because that is a little bit different in pregnancy, and there are some chiropractors that don't feel comfortable working on pregnant women.
Yes.
And then there's some, like...
Make sure they're certified to be doing so.
Yeah. Like Erica Hernandez, I mean, she knows what she's doing when it comes to the pregnant body. And
she's had a few babies, too.
She has. And I think she might be currently pregnant. So.
I have a pretty good feeling she is. Okay, so check this out, you guys. We're going to take a break right now. We're going to come back, finish up any of the aches and pains we haven't thought about. If there's something that you guys have thought about or you're experiencing currently, why don't you post it up and we'll talk about it.
Yep.
Can't wait. We'll see you guys back here in just a couple minutes. Thanks for joining the Preggo Posse. Some of the stuff to help you.
All right.
I'm watching. I gotta
We're back.
press play again. So I can see what
back?
these people are saying. And we're back! What's happening, party people? I think we're back anyway.
We are. So
Wait,
tell me about blockage.
Blockage happens. But we talked about one type of blockage already when we talked about constipation.
Right.
We're going to talk about another type of blockage. A lot of times when moms have all these hormones going through their bodies, they will get like really, really sensitive mucosal linings, like in their nose, parts of the ear. These will swell up and it'll cause blockage. What can they do about that?
Nasal saline.
Saline flush.
Nasal
neti
saline.
pot.
Yeah, you can do a neti pot. You can do that once a day when you're pregnant.
Yeah.
And then just regular nasal saline. So Arm & Hammer makes
Yeah.
one. I believe the Ocean Spray is another good one.
Yeah, I like the Ocean Spray. It's orange
Yeah.
and white. That's a good
It's
one.
easy to
Hey,
use.
BC's coming.
So
Get back in the mix. Come on, Bubba. This is our dog that joins us every time. Come on.
come on, BC, come on up.
Everybody loves him. You guys love him. Here he comes. Okay, so let's see here. I'm not getting any more of these people that are watching us, any of their comments right now. Maybe I need to come out because I know someone's writing. So we're going to get back to that in a sec, guys. But so that's another thing, the blockage. I want to show you guys a couple of things. Hopefully this is going to work just really fast. That can really do some relief for mom. So we're going to get started on that in just a second here. Let's see how we're doing. Okay, are we back? I want to make sure we're not missing any of your questions, you guys. And I think we're good. Amber says she's loving the rice sock for the backache. There we go.
Amber, rice sock, awesome point. So a rice sock, if you take a plain old sock, knee-high sock, clean sports sock, fill it with about 2 to 3 cups of plain old uncooked white rice. I love Jasmine because I think it smells awesome.
Yeah, who doesn't?
But not the minute stuff, real regular rice. Tie a knot at the end of the sock and then pop it into your microwave for about 60 seconds depending on your microwave.
Yeah.
And have you ever seen a salt shaker with rice inside of it at a restaurant? They put that in there to absorb that moisture from the salt so that the salt doesn't stick together. When that rice is heated up in the microwave, it actually releases that heat. And so that moist heat is a lot more effective than, thank you BC, than the dry heat that you might get from like an electric type of heating pad. Electric heating pads can also get too hot. Like even though you plug it in, you tell it low, medium, and high, they're not really very well controlled as far as how hot they can get, and it can be deceiving. So I think a rice sock gives you a little bit better control, and then that moisture drives in that heat. So all the aches and pains that come up in pregnancy, back pain, shoulder pain, knee pain, whatever, you can use that on there. And it's so easy to do. Everybody's already got the ingredients. You can also use it postpartum. So when your uterus is contracting back down to the size of a pear from the size of a watermelon, then you can lay it across your belly and it helps with that.
Yeah.
And if you don't heat it up quite as long, so it just should be warm, if your baby has colic, you can also lay it across baby's belly and it can help with the
It's
colic
amazing.
baby.
It's such a
Great
good
point, Amber. Thank you.
Good thing. Amber rocked that one for us. Leslie says, can you set a lag point for what? A lag point? Can you set a lag point? I don't know what that's for.
What is a lag point?
Tell us what that is, Leslie. We'd love to set one if we can. Okay, I'm going to show you guys something really quickly. For those of you who are Preggo out there, I want to show you guys how we can make things a little more comfortable for mom. No matter if your partner, if your cousin, if your aunt, whatever you are, there's a way to make mom a little more comfortable. So I'm going to show you first, after I get all fancied up here, what's up? I'm going to show you one with a fist. So if you don't have anything near you, Mom, open your legs a little bit. Mom. Dr. Morales. Okay.
Pretend I'm pregnant.
And you're going to go like this. I'm going to put my fist just above the butt crack, and I'm going to hold her shoulder, and I'm going to say, push your booty into my fist. How does that feel? Even on someone who's not pregnant, that feels pretty darn good.
Yeah, that feels good.
And so this works really well for moms. The other thing that works really well too is I'm gonna back off of that because you're pushing, and then I'm gonna put my fists right here on the side, and I'm either gonna squeeze in like this, or I'm going to just rub like this up and down, and that feels really good when mom's pregnant. It makes such a difference.
It actually doesn't feel so bad when you're not
No,
pregnant.
it doesn't.
But
When you squeeze in, it really feels good.
I've seen
That's
this
like a good
be
one, huh?
awesome in labor, and then also pretty awesome whenever they're just achy and full and just.
I can do a
stretched.
hip squeeze with the scarf too, so I'll put it over the middle of the booty right here, a little lower, like right about there, yeah. And then I can go like this. How's
There
that?
you go.
That feels good, huh? And that just does a nice hip squeeze on her. And I'm using this just like I would use a rebozo. This just isn't as long as I usually go. So those are a couple little things that can help mom's back feel a little better.
Awesome. Now this is just a simple scarf, but
Yes.
he mentioned rebozo.
I did.
What's a rebozo?
A rebozo, I like 9.5. I mean 9 feet by about 1.5 feet, 2 feet. Nice and long, and it's something that I use, and some people use. Different people use it. You put it around mom's body. You wrap them different ways. You can use it to stretch mom. I use it when we're in labor. You've seen this a couple times when mom's in labor, and what happens sometimes is they start pushing against their contraction, and their cervix is not complete yet, and they start getting thickening of that cervix. So it slows us down a little. Baby can't get the head past that. So what I do is I'll have mom go on her hands and knees. I'll put it over her booty, and I'll just go sideways when she's having contractions, so she cannot push against it anymore.
Awesome.
And then I'll give her a little massage in between. Then we get back at it, right, BC? We know that. Look at this guy.
So I think that's pretty good coverage of aches and pains.
Yeah.
I mean, it's definitely not exhaustive. There's so many things that can change in pregnancy.
But we only got a little bit of time for this.
Yeah.
But we want to give you guys as much info as we can.
Super important caveat though, if it is a new sensation and it's ever severe, especially if there's any kind of vaginal bleeding that goes along with it, if there's ever any fevers or chills, that is not normal. Call your doctor and let them know that that's going on.
Get on the phone. It's really important.
Yeah, you're not being a wimp if you're calling that in. That's important to figure out if it's something significant.
It's preferred that you call in. Your doctor will like that a lot more, right?
Yes.
Than you letting it go and then it becoming something really big, and you have to address it a different way, right? So let's talk about our next topic.
Navigating the hospital.
Navigating the hospital. We're just going to give a couple little tips here.
Yes.
So the hospital is a great place, but it's a tricky place because a lot of people, they research everything. We've talked about this before. Strollers, car seats, this, that. They rarely look up the stats of their hospital, what the procedure is at their hospital, let alone take a tour of your hospital. First and foremost, take the tour. Get to know what's going on there. Get to know where you're going and see some of the players in action and see what they're like when you're there so you know what to expect. That's one. Two, and I'm going to let you take over a couple of these. I always tell people you have to open up dialogue with your physician because you have to understand what you're going to get into and how you want to birth. You also have to understand how you personally feel about birth and how you want to birth. What are your goals and understanding that they may not be totally attainable, but you can try and get as close as you possibly can, and that's doable. So it's important to get to know that. And then I'm going to tell you a couple things they have in the hospital, but let's get Dr. Morales' bird's eye perspective on this.
So I promise you that your goal of having a healthy baby and having a safe delivery is the exact same goal of the hospitals.
Yeah.
I promise you. That's what their goal is. So if you want to have an epidural or you don't want to have an epidural, these are both possible things in a hospital, and these are things that that can be accomplished safely in a hospital. But there's just little things along the way that you need to find out, little differences. So how necessary is IV fluids going? Some hospitals are pretty emphatic and have this, have a rule that you have to have IV fluids going,
Absolutely.
or that you can drink or that you can't drink, or maybe you can have a HEP lock. It's important to find out what those sorts of rules are in the hospital that you're going to deliver at, so that if you have this idea of how that process is going to happen and how you're going to get from point A to point B, but let's say the hospital's rules are a little bit different than what your idea of how that process is going to go, that can really color your experience, and that can kind of shatter your whole experience because you had this idea of how it was going to go, but then you find out that maybe your hospital will only allow one person in the room when you're delivering a baby, and maybe you have to have IV fluids, and maybe you can't drink anything after you get an epidural. So it would be important to know those sort of things ahead of time. And if you take a tour, and my dog is snoring, if you take a tour and you find out these things, you get answers to these questions, that helps you mentally prepare so that you can start to shape what your experience is going to be, and it won't be contrary to what the reality is going to be, if that makes sense.
Yes, and I have to say that Leslie says she agrees 100% with taking the hospital tour. Thank you, Leslie.
Ask those questions on the hospital tour as well.
Myra says hi to you. Myra Coronado. And Jeremy says, what about swollen feet? Oh, boy. What about swollen feet?
So, Jeremy, first of all, you should be massaging those swollen feet every night for at least 20 minutes.
And the legs.
You're welcome, ladies.
Yes.
Very common to have swollen feet in pregnancy. Your blood vessels are a lot more leaky in pregnancy. You've got a big uterus that is pressing on blood vessels and lymphatic channels that are supposed to be returning fluid back up to your heart, and they can't do that as effectively. So you're going to have some pooling of that fluid that's leaking out of your blood vessels a bit. Swelling of the feet is very common. However, if it happens suddenly, and you've also got a headache, and there might or might not also be some vision changes,
I smell preeclampsia.
this could be an issue and could be preeclampsia. So if those sorts of things line up, you probably want to mention it to your doctor.
Yes.
That way they can take your blood pressure and they can reassure you, nope, everything is good, or wow, I'm glad that you came in for the swelling feet because you have preeclampsia, your blood pressure's up, and that's a problem.
Yes.
It's also important to know if you have one foot that's significantly more swollen than the other.
Oh.
Because a blood clot in your legs can
vein
also,
thrombosis.
deep vein thrombosis, can also present as just one foot or leg being a lot more swollen than the other. So look at the symmetry of the situation as well.
Yes. All right. Sorry about that. We did forget that one.
Yes.
But, okay, so there were a couple things here. First time mommy's hospitals no longer keep your baby in the nursery. Not all hospitals do that. So
Yeah.
you can't say that to everybody. I still know of a couple hospitals where the nursery's still going. Some of them, they're not going strong at all. Some of them, they are still going as strong as they were the day they introduced the nursery. Matter of fact.
Yeah.
A couple hospitals here in our city do that.
So you got to find that out from your hospital and find out what kind of support you'll have. You're right.
But you can
Absolutely
also
right.
tell them, my baby's not leaving and going to the nursery. That's it. It's my baby. It is your baby.
Mhm.
You can see. I mean, could be controversial, but hey, Rome wasn't built in a day, right?
Jeremy says, I just got punched as you said that. Ha.
Sorry, Jeremy.
So Amber,
Amber.
best time to take, yes, once you're allowed to walk around again, Amber, I think probably later on in the second trimester, like later in the second trimester is a good time to start looking into it. I know at the hospital that I deliver at, they fill up fast. Those tours fill up fast.
Yes.
So if you're looking for a Thursday night tour, because a lot of people like that one because, they're working during the day and both mom and dad are able to go on that tour, or Saturday morning because that's the best time that you can get childcare, you're probably going to need to book that at least a month in advance. So if you're starting to make that phone call around 22 to 24 weeks, you're probably going to get a tour probably early in the third trimester,
Yeah.
later on in the second trimester. And a lot of hospitals too, once you take that tour and you pre-register for your hospital, that's super important as well. You're eligible for birthing classes in the hospital, sometimes at a discount, sometimes for free, sometimes just eligible, period. So you want to know all the different perks of being able to register at a hospital, and once you register because you've taken the tour,
Maybe you get a
get
soda,
those. Right, maybe, or free parking.
or free parking,
Mhm.
or sandwich.
Right, or a sandwich. And you need to know where to go. You can wing it. You can have this glorious idea about exactly how you're going to deliver and how everything's going to go, and you love your doctor and you've already chosen your nurse because she's a good friend of yours. But when it starts getting crazy and your water broke and you've got a lot of painful contractions, the last thing that you want to do is, try and navigate from parking garage, whatever, and down the hall and turn right and turn left, but there's construction, and so you got to go around the construction. So you got to make sure that as we used to say in the military, you got to recon. You got to find out, where am I parking? How am I parking? How close is it from parking to where I need to go? What's the best entrance? What's the quickest entrance? And then where am I going to go afterwards? Because after you deliver, they're going to take you in a wheelchair or a bed, or you're going to walk to your postpartum room, and then you're going to have to tell people where you are.
Wilco.
So, right.
I had to get back military with you.
Thank you.
Thank
Thank you.
Okay,
So
Ghost Rider.
recon the situation first.
Let's recon.
Right.
Let's go in and let's do some pregnancy recon, people. We're
Yes.
going deep in the trenches. All right.
Yes, and Jeremy
Of
also
pregnancy.
says register for Women's Plus, men and women, small perks. Yes, Methodist in San Antonio, Women's Plus allows you, I think there's parking deal that's involved. There's like a free meal that dads get while they're there. So
Yeah.
there's some good
You
stuff.
get a
with that
shot of
for-
tequila. There's a lot of good things.
A
that
shot
go
of
on.
tequila.
We're in San Antonio.
Right.
Yeah, during Fiesta Week.
Tacos.
Sure. A taco. You get a taco. It's Taco Tuesday. Oh, it's not Taco Tuesday. Okay, so check this out, you guys. So we were talking about some of the things with navigating the hospital. The other thing you have to navigate is, we talked about this not too long ago. You and I had a conversation. There are 3 types of people that you're going to encounter in the hospital, and you
Right.
have to be able to navigate that because, and I'll tell you why. When you have a baby, it's very exciting. You're really happy, you're very excited, you're scared. There's a lot of things that go around it. There are a lot of emotions and they're heightened. And oftentimes when we're in one of these states and we're coming someplace where people will take care of you, you're expecting that feedback and you're expecting that general comfort and the comforting that occurs.
Right.
Unfortunately, you're going to get some people that are behind the desk that don't even look at you and acknowledge you. You might run into that every once in a while, right? And they're just disconnected and they're not in. You're going to find someone who's middle of the road. Hey, how's it going? All right, great, awesome, yeah, let me call my friend, but busy doing stuff, and then just kind of ignore you after the immediate recognition. Or you're going to find the people who are truly there to serve you, and those are the people you really want to be with. But you can't get your game all torn up with the other people that are not giving you exactly what you want. You cannot act like you're upset and angry, especially as a partner, because you need to keep mom calm. Because the whole name of the game for the hospital is to keep mom on track. Because when you're in a different area, you don't have things that are your own. You're hungry. You're not eating once you get admitted in the hospital. There's a lot of things that go into line with it, and keeping mom happy keeps her oxytocin flowing, and that is such an important deal. Making sure you keep that whole situation good. So don't get upset by the things you encounter. Just know you're going to encounter everyday things, even though this is a special day and special time for you. Not everybody else is feeling it, so that's just the way it goes.
Oh, that's a great point. Yeah. Agree, 100%.
What else do you think is pretty important? Understanding what you're getting into.
Understanding what you're getting into.
Pushing.
I think it's important to know that there are interventions that are sometimes necessary.
Yeah.
And it's helpful to learn about those interventions ahead of time. So your doctor may talk to you about breaking your bag of water. It sounds like this crazy traumatic event, but it's actually really pretty uneventful, pretty easy, pretty straightforward. But it's helpful if they show you what they would do for that ahead of time. And so a lot of times birth classes will cover that, and they'll show you the little hook that we use and kind of give you an idea, right, of what we do and how we do it.
I use one to crochet a hat.
It looks exactly like a crochet hook. So if they come at you with this hook, you're not like, oh my gosh, what is that? What are you about to do to me? Sometimes we can't follow baby's heart rate on the normal external monitors. Either it's just difficult to follow baby, we've got a very active baby, or it's just difficult to get to baby's heartbeat with that monitor. And if things are looking kind of dicey and we really need to know how that heartbeat is because we're worried about baby, then sometimes we'll use monitors on the inside. And so it's helpful to see what that is, what that involves, what that looks like, so that if you are encountered with that, it's not completely foreign to you and it doesn't raise a whole lot of anxiety because, hey, they showed me that and I know what it's used for and I know why you're doing it, and so okay, I'm not as anxious about it.
Yeah, it definitely takes the edge off.
Right.
And understanding why they might have you break your water is also an important thing. So if you picture I have a water balloon in my hands and I'm pushing on it, I'm trying to touch my hands together, I'm going to get some resistance, right? Because I have hydrostatic pressure inside of there. When you break that, so basically you're getting more bang for your buck with your contraction.
Yeah,
and if you've been kind of moving along, it's going a little slower than they like to see generally for safety in the hospital according to the rules, right? You got to play by the rules. Then they may want to step things up by doing some sort of intervention. Interventions are something you need to get familiar with. There's not a lot of them, but there's enough of them that you should understand what they do, why they help, why are they intervening, And
then also the post-delivery interventions as well.
Yes.
So your uterus has been big and expanded, and after baby's out, it's going to need to contract down. So something that a lot of moms aren't anticipating is the fact that we're going to be rubbing that uterus, bundle massage. That nurse is going to be rubbing it like every 15 minutes right after delivery.
Yeah.
So that can be a little bit intrusive, but it's so incredibly necessary. You will be producing your own oxytocin to help that uterus to cramp down.
And if you're breastfeeding, for sure.
And if you're breastfeeding, that definitely helps. That latch, that nipple stimulation is going to get some Pitocin, some oxytocin going to help that uterus to cramp down. But if it doesn't, we need to know if it's not happening, because you can bleed a lot. You can have some significant issues if that uterus doesn't cramp down.
But if you have some residual placenta or something, that's
we need to find that out. And then baby as well. So once you go to your postpartum room, they're going to be doing vital signs on you. They're doing vital signs on baby. They're checking baby's bilirubin. They're doing other state-mandated labs, looking for different things, different metabolic disorders and things. So there's certain protocols and certain interventions that they're going to be doing afterwards as well. It's not like you're just going to have a baby and then you're going to go stay in a room kind of like in a hotel and they're going to leave you alone for a couple days. There are some things that they're checking and doing afterwards to make sure that you and baby are safe.
Yes, and so you have to understand when you have a baby at a hospital, almost every hospital is going to hook your IV up, even if your IV has been unhooked, because they are going to give you Pitocin, which is a synthetic of oxytocin, basically. And what that does is that helps your uterus to contract more and more,
right.
so you don't bleed out. And that's just the way that it's done. So you have to understand that's possibly going to happen. So that means when you go to breastfeed, when your baby starts rooting. Remember, you guys, really quickly, crying does not mean your baby's hungry. Crying means you waited too long. Everybody goes, you feed the baby when it cries. I'm like, no, that's too late. You want to look for feeding cues. You'll have a much happier baby. And you don't want to have to fight to try and get them to eat when they're crying, right? So bottom line is, if you're going to breastfeed and you have an IV in your arm, it's going to be a little tougher in the hospital. And if you had an epidural, you're going to have on the other arm, you're going to have a blood pressure cuff. So you're trying to manipulate your new baby. And if you've had an epidural, you're going to be in the bed, not able to move very much. You're on fall precautions. A lot is going on. So it gets a little tough to move your baby around. So just be expecting that and expect that it's going to be a learning curve and you're going to have to take some time to do it. But it's doable. We do it all the time. And if partner has to help you, partner needs to help you and go and move the baby into the right position and all that stuff. So it's really important that if you guys are taking a breastfeeding class, you guys are both taking a breastfeeding class, and it's inclusive to your partner. A lot of classes, I'm just being honest with you, you guys, and I say this, I'm sensitive about this because I am a male in the birth world, and I will tell you, it is so, a lot of things are so just mom, 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 mom. You know, that when you're at a birth class, it can be a little, it can make dads feel a little bit like they're being segregated. So integration now, segregation never. It's really important for partners to be involved too and know how to help. That makes a big difference. So we're looking good with that.
Yeah, and delivering in most hospitals also affords you several visits with the lactation consultant.
Yes.
So you should have the nurse helping you out with breastfeeding. You should have the lactation consultant visiting you while you're in the hospital. And so, yeah, there's a lot of people coming in and messing with you, but a lot of this stuff is really very helpful, making sure that you're successful and that everything is safe with you and the baby.
Yep. Okay, so Jeremy said, register for women's. We got that already. Sorry, Jeremy. My sciatica pain has been really bad lately. Just a few more days to go. Okay, Myra, yes, that is, she's ready, she says. But yeah, sciatica pain can really hurt. Try the exercise I was just doing with Dr. Morales where I put my fist in her back. Have someone do that to you. Don't do it to someone else, it won't help your back. But have someone do it to you.
Right. Sure. And Eric is right. Chiropractic care can definitely work for that kind of pain too. And afterwards, because a lot of those aches and pains that happen, especially in the back, they do not get better immediately after delivery.
No.
In fact, a lot of times women will get an epidural and then afterwards they say, man, that epidural is hurting. It's, 4 weeks later, my back is still hurting from that epidural. And it's not the epidural. It's the fact that you've been carrying a bowling ball around in your belly for 9 months and you've got an exaggerated curve in your back to keep from tipping over. And that's been really putting a lot of stress and strain on that little back.
Leslie stated something very important, that the doggy is loving life right now. That is super true. Super true. How far along dilated do you have to be admitted to the hospital? They'll take you usually if you're not super dilated. That's the problem. Dilation, this is something that's important to me. 0 to 3 used to be early labor. ACOG changed it because too many inductions and too many cesareans. Because when you go in and you're under 4, in my opinion, and who am I? Just the birth guy. But in my opinion, if you're under 4 centimeters, I want to be.
That's not really labor.
Yeah, I want to be staying. I would take off, go eat some food, see how you're doing in a little while. Just get your freedom in there, because it could be hours. If you're at 4 centimeters, we're looking at 12 to 24 hours sometimes before you're going to see that baby, if not longer. I've seen inductions that go 3 days. Good gravy, right?
Yeah.
So you need to think about things like that. It's super important. The other thing I was going to say is with anything you're looking at, when you're getting ready to have a baby, when you're getting into the hospital, if you don't know what your doctor's going to do for you, that's a problem. So there's plenty of ways to catch a baby, but you have to ask your doctor, can you catch in this position? Can you catch in this position? Can you? And they may say no, no, yes, no, yes. You know, but that also opens it up for you to understand what's going to happen when you're in there. So you're not like, he's telling me no, I'm about ready to push this baby, and what's happening, or she's telling me no. You need to understand that if you don't have that knowledge ahead of time, not really their fault. They would have told you.
Yep.
So kind of important.
What happens
else?
if your doctor isn't there? Another doctor will deliver you. Yes, it is really rare that a nurse will deliver you. That's just if the doctor can't get to the room in time.
Yes.
But there's always a doctor who is covering on call for your doctor if your doctor isn't available that particular night. And sometimes you get to meet those on-call doctors and sometimes not. It just depends on your doctor's group. If they're in a big group and they take call every 10 days or something, it's probably hard to meet the other 9 doctors that are in the call group. If your doctor's in a smaller group and they're on call every other night, I feel bad for them. That's a very tired doctor. But you probably would get a chance to meet the other doctors in the group or midwives if they were involved in that kind of small practice.
From real. Okay, Arlene says she loves you.
Aww.
And Maria says
you.
when getting an epidural is the only birthing option to be laying down on your back. No, not totally.
No.
Because look, you have a couple choices here. If you're getting ready to push, you can ask them to back the epidural off, one, which helps a lot because then you'll be able to feel what's going on. You won't tear as much probably.
Yeah.
2, you can use the squat bars. And that's something that we're liking using. You can get the squat bar up around the bed if they have squat bars. Most places do. If you have a rebozo, I put the rebozo around it like this so mom can actually grab onto the rebozo and be like, hang on to it. Or mom can lean up against it like this and hold on to it,
Right.
and partner can be there supporting her, nurse can support, and doctor can catch like that. So there's a couple different ways you can do it. Okay.
And
Always
having an
choices.
epidural, laying on your side, sometimes we want you to deliver on your side with an epidural if the baby's heart rate is doing some funky things and we're worried about laying on the cord or that baby having some kind of distressing signals on the heartbeat, then laying on your side can sometimes improve that. And yes, Arasti's been amazing too. And then
Everybody's up there.
So Deirdre points out, yes, if you are a scheduled C-section, so let's say you're a prior C-section and you know you're having a repeat C-section, or you have a baby who happens to be in a breech presentation and you already know that you're having a C-section for that delivery, if you come in and you're contracting and you're 2 or 3 centimeters and you weren't that dilated the day before, you're not waiting until you're 4 centimeters. You're probably getting admitted right then and there. It may be early in the process, but that's okay because we don't want you to be in full-blown labor when you end up getting your C-section. So great point, Deirdre.
I would rather see people coming in if you're having a normal, healthy pregnancy, no complications. Like coming in when you have bloody show and you've got some aversions to food, you're nauseated, you've thrown up, and you can't talk through your contractions besides speaking French. You know what I mean?
Yes.
Hubby and I had a wonderful experience during our delivery. Thank you, Dr. Morales.
You're welcome.
That's
Thank
great.
You guys.
Okay,
that
we're giving away a Britex infant car seat. Yes, we are giving away a car seat. Tonight, I think we're going to do it differently, though. We are going to let you, whoever the winner is, pick if they want a convertible or an infant seat. And then we'll let Britex do the rest. I think that'll be kind of fun.
Yeah.
Like, what do you want?
So how are they eligible? How do they get in to get
They need to share this video right now. Share. Press the share button on your phone right next to where you can comment. That's one way. 2, we need you to put your email addresses up in the comments right now. If you want to win, put your email address in the comments right now. Next month, we're going to be using something new I didn't tell you about called Rafflecopter, where we won't even have to do any of it. It's going to do the raffle for us. Then you guys will just have to sign up with Rafflecopter, which will be pretty cool. So you guys ready to do it? Come on, I know you guys are going to win, so let's get everybody in there. Keep going. We have another topic, but we're going to take a break in just a second here. We're going to get on with our last topic, which is going to be early labor and just some fun things with early labor. Then we're going to do our segment that we did last month called the Posse Picks.
The Posse Picks, right. And so before I forget, though, if we don't address your question, we just have limited time. If we don't address your question, Hopefully somebody else on the chat room can answer it, and then we will also try and go back and be able to answer it in the chat room as well. We don't want to leave you hanging, but we definitely want to try and cover all of our topics in our limited time allotted. So thank you for the questions. Keep them coming, and I think we will.
That's why we're always looking down. We're trying to watch for your questions. Okay, guys, we'll be back after this message. Yeah. For Austin, wait a minute here. You wrote December 3rd for Austin. Are you going to be coming and seeing me, Leslie, in Austin at my show coming up? I hope so. Next month I'm going to be in Houston, by the way. If you guys don't know any of this, I'm going to be in Houston next month in November. I believe mid-month. Find it on thebirthguy.com. Look for my upcoming events on my homepage. I'd love to meet you guys, Houston, and I know a lot of you guys already. I was just on Houston Live yesterday on their TV show, their midday show. I did a segment about being a doula and about some of the things, the top 3 things I would bring to a birth. We can talk about that at some point, or you guys can watch it on Houston Live. I want to tell you guys, I would love to meet you guys in Houston. I'd love to meet you guys in Austin. Austin is in December, and then we have like 15 to 19 shows we're talking about next year. And next year, I'm going to be doing something really kind of fun. After the show on Saturday or on Sunday, depending on when the show is, I'm either coming back to that city or the next day, we're having a sponsored event just for dads with me.
Oh, that's awesome.
Yes, and it's free for the dads. They get to come, hang out for a couple hours with me. I'm going to talk about being a parent. I'm going to talk about some things they can do during the pregnancy and during childbirth. It's going to be great. That dog just let it go right there. I love it.
Thanks,
oh my God, that was not me, and I'm blaming the dog for sure. All right. You guys know what I'm talking about. But anyway, I hope to meet you guys sometime soon. If we've never met in person, I'd love it. And anybody here in San Antonio, if I haven't met you, I'd love to meet you guys too. So reach out. Let's talk about early labor. Early labor is a fickle bee. That's all I can say.
So what is early labor? What do you mean by early labor?
I mean, damn, you're in labor and it's early. No, what happened with early labor is a tease because
it is.
Stop, start, Braxton Hicks. Everybody knows what Braxton Hicks are, but I'll tell you if you don't know, Braxton Hicks are when you get kind of a fake contraction, your stomach gets real tight, and you're like, oh my God, am I in labor? And then it happens again, then it doesn't happen for a couple days or a few hours or whatever. Early labor is designated by the stomach tightening up like a contraction, but you can talk through it. It doesn't really like hurt you, but you're like, ooh, okay, I felt something. That's cool, but I can still walk. I can still be at work, right? Mm-hmm. I can go out to dinner. I can take a walk with my partner, make some love. I can eat some food.
Right.
You can still do all these
things.
things.
You notice it. Like you can notice that pain. You notice that contraction.
Here's a catch. The catch is you have to contract once every 5 to 20 minutes to be truly in early labor. That's
At
the rule of thumb.
least.
At least. You have to be consistent with that, though. Every 5 to 20 minutes, we want to see a contraction. But we'd like to see them not scattered around, like 5 minutes, 20 minutes, 30 minutes, 10 minutes, 40 minutes, 10. We don't want to see that. That's not really early labor. You're still messing around. Your body's kind of checking it out. Once you start getting consistent, that's early labor.
Right.
Active labor will come after that. That's when mom will get nauseated. She'll see some bloody show. She will, have food aversions. Probably look just right through you like you're a glass. Just.
She kind of gets in her
Yes.
zone. She just gets in this.
And that's when she's
focal
gonna get
spot.
serious. Like, it's time.
Yeah.
When you go to the hospital and you're in early labor, chances are you're not really that dilated, one. And two, when you do that, you're going to get discouraged, because going to the hospital and getting sent home, or going to the hospital and finding out you're way less than you thought you were, that's a buzzkill.
Mm-hmm.
And you're pretty happy when you're going there because you're going to meet your baby, you think. But it could be a much more,
Right.
a much longer journey for you. If you stay at the hospital, most likely you're going to get some sort of induction, or you're going to have some sort of help with Pitocin or breaking your vagal water, or something's going to happen.
I mean, that early labor for some people can happen every night for a few hours, and then it gets better, it goes away, you go to sleep, you wake up the next day, you're like, well, I'm still here, I'm still pregnant, and I don't feel those pains anymore. And then it happens again that night.
Yeah.
And then it happens again the following night. And then one night it'll happen and it won't really go away, and you won't really be able to get to sleep because you'll just still feel it. But you're still kind of talking through the contractions and the cramping. That's probably a potential good time to call your doctor, let them know what's going on, depending on your situation, depending on if you're heading towards a C-section eventually, or maybe it's a little bit too early to be having that kind of contraction pattern. If it's something consistent and it kept you up all night, you should probably let your doctor know. But does it mean that you're going to be admitted to the hospital because you're about to have your baby? Not necessarily. Early labor can be kind of like a long and drawn out event, and it can be frustrating.
Go to the Olive Garden. Have some hospitaliano.
Go to Whataburger if you're in Texas.
Go to
Whataburger,
In-N-Out Burger if
go
you're in
to-
California. Or if you're here. Not really? Oh, man.
Whataburger. Sorry.
I
This is,
like
I mean,
Whataburger.
San Antonio. This is San Antonio.
I know, it's
So
right behind us. Look, you see the Tower of Americas
stick
and everything
with San
here.
Antonio.
Okay, so I think that next month we'll touch base on water breaking again, because that's always a confusing one for people. The two scenarios that happens in. You guys, early labor though, I want to tell you, I have a little trick I like my partners to do. I like them to make a list of movies that are coming out that you want to see, and you cannot go to the movies until you're in early labor.
Oh, that's awesome.
Yes, because moms, when they're in early labor, if they're not totally going, they get very discouraged and very bummed, because it starts, it stops, starts, stops. They can come in and be showing that they're 2 centimeters dilated,
Right.
and then next week come in and still 2 centimeters, and the next week 2 centimeters and maybe a scotch.
Right. And then
That's
they're thinking, I have to
disappointing.
stay pregnant forever.
Yes, my body's not working. I'm not being a good mom. I'm failing. You're not. It's not. That's not how it works. The body just takes some time, and you got to wait for it sometimes. And the waiting is the hardest part. We all know that. So
It's worth the gains.
I'm showing you some love, Tom.
So,
So, anything else you want to add about early labor? There's so much we can talk about, but we're just kind of touching the surface. Let's see what you guys have to say. I'm sure you guys have some things to say. I'm going to announce our winner in just a little bit.
Erica points out that some moms experience prodromal labor, yes, and one or more chiropractor adjustments may help reposition mom's pelvis and uterus to give the baby plenty of space to reposition, help mom progress, and deliver baby. Absolutely. There are definitely some things that you can do to kind of get that pelvis to cooperate and get baby to cooperate, to try and get into a better position and come down further in the pelvis. Some things that you can do at home. I have all my patients at 32 weeks and beyond start to do some pelvic tilts, your cat and cow yoga maneuvers. Squatting can also help with that pelvis and help with that shape and help with the direction of baby, keep baby from being OP or occiput posterior.
Sunny side up.
Sunny side up. We don't want sunny side up babies, because sunny side up babies tend to cause a lot of prodrome labor.
Yes.
It's uncomfortable. That uterus thinks it's ready, it's
Starts
stretched out
hitting
enough,
nerves.
but that baby's like, no, I think I'm gonna hang out here a little bit longer, and I'm just gonna hang up by your tonsils.
We want them by the crown.
Right.
We don't want them the other way.
Coming out.
Okay, Leslie said that her labor kept stopping. It was going strong, and then it just stopped. 20, 30 minutes later, just kind of fizzled out. That happens sometimes.
Yes.
And that's when
So
they usually, if you're in the
annoying.
hospital, they're
So
probably going to give you
annoying.
some Pitocin to try and get that back up again and get you into a rhythm.
Nice
That
Londo,
happens. That's probably what
Santico's
happened,
baby.
Huh? What happened? Who was the Santico's baby?
I don't know. Londo mentioned Santico's baby.
Oh.
You watch those movies, right?
Well, major lag on my end. I don't even see that comment you just read. Oh, okay. Sorry if there's a lag, guys. You know, Facebook works that way sometimes. Your internet could be working kind of tricky. I'm sitting right next to the magician right now, and on my screen, I don't see what she's seeing on her screen. And so it all happens. Press play. There we go. Yes. So I've lost it, and now we're back. So anyway, you guys. So it just depends on where you're at. We're sorry about that, but this is all going to be on Facebook. You can rewatch it. You can send it to your friends, however you want to do it. Okay, so let's talk about a couple of other things.
Okay.
With early labor, it's really important that mom gets sleep. Moms
Oh, that's
don't sleep.
key,
They
yeah.
think that the party's on, and they start getting crazy, and that's not what we want. We want mom to be getting rest, because you cannot pain cope when you're exhausted. It is very difficult to pain cope when you're exhausted. I always give the example of if you are super, super tired, you know this feeling because you'll be
Right.
on call, you'll be in a long
Yes.
stretch, and then suddenly you stub your toe. You are defeated. You are not
It
feeling powerful
hurts
through
and
it.
you're grouchy and you're just not effective. You need to be
Yes.
effective for when it's actually go time.
And if you're sleeping and you get up the next day and you're like, whoa, you're so energized, you're going to go tackle the mountain today, you're going to do it 3 different ways, and then you stub your toe, you're just angry.
Right,
And
right.
so you get through it, and then you end up moving forward, and you know, you get through the pain, and you're just focused on what you're going to get done today. You're not lingering on the pain. It's not throbbing and killing you. You get it. You go through it. You can definitely pain cope better when you're well rested. Partners, get her resting. Make her go to sleep. Make some love and go to bed. It's a
Go
good
to
thing
bed.
to do.
Partners, do the laundry, do the dishes. Just
Yeah.
let her go to bed so she doesn't feel that she has to stay up and do those things.
Yeah, or hire someone to
Right.
do it or something. All right. So that's it. We're gonna now talk about one more thing. We are going to talk about for the end of the night, you guys. Anything you guys want to talk about?
Oh, we
You
need
better
to do
ask
the,
us first and foremost.
We need to do the posse picks.
Posse picks for the week. What is
Right.
your posse pick,
Oh,
Dr.
I get to go
Morales?
second this time.
Oh, you want to go second?
Yes,
okay,
I
you
get to
gave it
go
away
second
last
this
time. I have a posse pick this week.
What's that?
My favorite thing right now that I'm really excited about is I just found out about stem cells in the placenta, and being able to actually harvest them instead of just getting stem cells from
Awesome.
cord blood. And to me, blew my mind. And getting to meet with someone that I knew about 20 years ago who owns this company, I knew about him when he was doing research. He would take the chorion off the placenta and put it onto the dura mater of the brain because of the undifferentiated stem cells, and it would help form a new dura around the brain if someone had a gunshot wound or something like that.
Yeah.
This is 20 years ago I knew about this and this guy, what he was doing, and I got to meet him and I got to tour his whole facility and what they're doing and all the different companies that work together in a syncytium, which is awesome. And just, there's a lot of exciting things. But coming up, I'm going to talk about that more. But the company's called LifeBank. The other one's called Cellularity. I would check them out for sure. I love it. That's my
super cool. That's
yeah,
your posse pick.
That's my posse pick because I can't
Cool.
stop talking about it. I'm so fired up about it because I'm a believer in stem cells because my daughter Eva, you guys might know this. I think I talked about this before. She was sick with Lyme disease for a long time, for about a year. We took her for infusion therapy. They did stem cells. They did all this other stuff. Lyme disease takes about 9 years to get people even 60% of where they were before they got sick. It takes 9 years to do that. Usually, that's the average. We fast tracked her. She had this done 6 months later. She's like a normal kid again. She feels so much better. Her diet's definitely on point right now. She eats to the Lyme disease diet, but she would not be where she's at if we didn't have that done. She had stem cells, she had infusion of aminos and stuff. So I believe in the stem cell therapy. And I've seen children who have had leukemia, all these other things. On top of that, could you imagine what's up for the future with a company that's doing stuff like this that's so different than everybody else? I love it.
That's cool.
What's your posse pick?
So this is hugely hugely important. This thing actually saved my life, saved my marriage, saved my sanity, and it is a book.
I know which one you're going to talk about.
Do you?
I'm not going to say it, but I'll just do something.
Healthy Sleep Habits, Happy Child by Dr. Weisbluth, spelled with a W. Sleeping is so incredibly important, and if you have had a baby before, so all of you prior pregnancy folks know what I'm talking about, you don't have sleep in the newborn period. I mean, you just don't. And so you think, oh my gosh, this is how my life is going to be for the next 18 years. I'm going to get woken up every 2 hours and I'm never going to get a good night's sleep again. Not true. Babies can self-soothe starting at 4 months. That's when they are out of the 4th trimester, 4 months. And this book, I think, is key at learning how to be able to sleep train and how to be able to understand what's going on in your baby's brain and your baby's sleep cycle so that you can see that there's a light at the end of the tunnel. So it definitely helped me out in trying to figure out how to get my kids to sleep so that I could have my life back 4 months after I delivered.
I love it.
So Healthy Sleep Habits, Happy Child, Dr. Weisbluth or Weisbluth, and get it, read it. It goes in sections, so it'll tell you about the newborn period. It'll tell you 4 to 6 months, 6 to 12 months. It tells you what to do if you go on a trip and everything gets chaotic and thrown off schedule as far as your kids' sleeping habits go. It tells you how to get them back into their sleep pattern to be healthy. So
I love it.
So who's our winner?
You're not going to believe this because she made a comment that's really funny as I get the text of who our winner is. She said everyone should get a Britex car seat, and I think that she spoke too soon because she gets it, but we can send it to somebody else. Leslie White, you're our winner tonight. And so we can send it to someone else if everybody should get a car seat. What do you think? You guys tell her.
Congratulations, Leslie White.
Oh, and she even, look at, she's saying nice things all over the place. She even said, I pray for all the pregnant women in here for a safe and fast delivery. That's super sweet. Oh, Leslie, I'm glad you won tonight. But we're going to be back at this. We're going to be giving away some other stuff. And we are definitely really grateful for Britex for sponsoring us. I'm going to be doing another webinar with Britex, or we may even do a Facebook Live. We did our first one on child safety this week, Bringing Home Baby. It was on Monday. You can go back and watch it probably. Go to the Britex Facebook page and go back and watch because there was a lot of good information. It was me and Sarah Tilton. She is a child safety advocate. She is the winner of the best educator in South Carolina for child advocacy. So she was my guest on a webinar that was sponsored by Britex, and we talked about child safety and getting your baby home. And there's so much more to go. We have 3 more webinars we're doing. So join us. Look on my Facebook and find out where it's going to be, or look on my my website, thebirthguy.com. You guys, I'm Brian the Birth Guy. I'm here with
Dr. Kelly Morales,
the magician. and we are the Preggo Posse, and we are so happy that we are here with you guys tonight. If you need anything, message us. Tell us if there's something you want to hear about next month. We're going to be here every month. We love this. This is our thing, and we cannot wait to get you more information. Tell us what you want to hear about. And if you guys have any comments about our show, let us know. We'd love to hear it. Good, bad, the ugly.
And BC says, woof.
BC says woof, and don't pull his paw because he keeps farting.
We'll catch y'all next month.
Have a good night, you guys. Thanks for joining us.
Bye.
Bye.